What in the world did I do?
Working with dementia patients has reminded me to enjoy the little things in life. Many of these patients live in darkness most of their day, but when they do simple things like color a picture or sing a song, they light up, and you can tell that they're truly enjoying themselves and enjoying that moment. And when you bring them back to their past, they light up as they tell you all the amazing stories and things that they've experienced. And it reminds me that these people may not be able to remember what they had for breakfast, but they still have a rich history and a rich past and so much to teach us.
Together, clinicians and researchers must provide the compassionate care and support to both patients and their caregivers that is critical to meeting one of the most daunting and rapidly growing public health challenges.
Across our country, more than 5 million people over the age of 65 have Alzheimer's disease, and about $203 billion are spent for their care. By 2050, the number of those with Alzheimer's disease and related disorders will escalate, with cost of care increasing to over $1 trillion.
I'm crazy for trying, and crazy for crying, and I'm crazy for loving you.
Currently, informal caregivers, who are usually family members, provide 17.5 billion hours of unpaid care to Alzheimer's patients, which translates into $216 billion of savings to the healthcare system. Unfortunately, the savings to our healthcare system comes at the expense of the caregivers, who are at increased risk for physical and mental health problems, including dementia. What can we do to support these family caregivers who not only enable their loved one to stay home rather than go to institutional care, but also save our healthcare system billions of dollars? Research has found that multi-component programs, which include both the caregiver and care recipient, are effective at improving outcomes for both. Ongoing contact between the caregiver and recipient, clinicians and researchers is important to helping caregivers find meaning in their role while showing them how to manage stress. The Memory Health Program offered by the Center for Success in Aging at Greenville Health System, in collaboration with researchers at Clemson University's Institute for Engaged Aging, is designed to improve health, quality of life, and cognitive functioning of both the caregiver and the patient. The program engages care recipients and caregivers in activities designed to improve engagement and reduce disordered behaviors of patients while reducing the stress of the caregivers. Activities include the use of music, nature images, and aromas to stimulate engagement of patients, and the use of Tai Chi and group discussions to help reduce stress of caregivers. Patients and their caregivers also learn to play board games that improve specific aspects of cognitive functioning while providing a fun activity that caregivers and their loved ones can do together.
What in the